Hello, and welcome to this COVID-19 vaccine Q&A brought to you by the Developmental Disabilities Alliance of Western New York. My name is Jeff Patterson. I'm the Chief Executive Officer of Empower in Niagara County and a board member of DDAWNY. And, we know that the workforce of the DDAWNY agencies is the backbone of our field. So we hope that today we can provide some good information so that people can make informed decisions about the vaccine. I want to thank the committee that's worked so hard on this event from agencies all over Western New York. You know who you are. Thank you for your efforts. Thanks to the panelists for your time and expertise. The panelists will be introduced shortly. At this point, I just want to hand things over to our moderators, the Executive Director of the Center for Self-Advocacy, Mr. Samuel Maddle, and the Community Relations Coordinator for People Inc., Mr. Bradford Watts.
Thank you very much. How is everybody doing today? I think we'll just get started right off. We're going to do introductions. First, we're going to introduce Dr. Michael Mendoza from the Monroe County Commissioner of Public Health, and Izzy Cruz, peer mentor of the Center for Self-Advocacy, and I'm going to hand it off to Brad.
Thank you, Sam. It's always good to work along with you, Sam, on all of our advocacy efforts that we do throughout the Western New York community. Again, greetings to Dr. Mendoza and Izzy Cruz. Also with us today is Devin Hegeman. He is a direct support professional at Empower. Teresa O'Brien, colleague of mine, Assistant Director of Quality Improvement at People Inc., who also has a loved one with a developmental disability. And Sarah Taylor joins us, a community liaison and training specialist at Elleversity, a division of Heritage Christian Services. Welcome to you all this morning.
Thank you.
Thank you.
At this point in time, we always like to have our moderators with an introduction, making some opening comments and statements to Mr. Patterson's point of saying this is a forum that we would like to have those that work in direct support areas, but also those that have families, loved ones, our advocates, and our community as a whole to be able to make informed decisions in receiving the vaccination that is out now from various agencies and community service providers. Today, we want to begin with Dr. Mendoza. We want him to speak, maybe give us about a 10-minute overview, Dr. Mendoza, if you can for us, and welcome again to you this morning.
Thank you very much, and thanks for having me here. I'm thrilled to be able to share some thoughts with you all this morning and hopefully answer some of your questions. All right, let me share the screen here. All right, so as you mentioned, I'd like to spend really no more than 10 minutes just giving a high-level overview of where we are with regard to the vaccination program here in Monroe County. I will skip for the moment all of the facts and figures about how the pandemic has gone, except to say that things are heading in the right direction. The numbers are improving. We are looking ahead to warmer weather. We are already beginning to see the impacts of the vaccine on disease rates and hospitalizations and other complications. So I think there's a lot of reason for hope. At the same time, the vaccination program across the country is the biggest public health undertaking of our generation. Nowhere in our history since 1918 have we undergone an effort as substantial as this one. Here in Monroe County, here in the region alone, we have 740,000 people in our county, 1 million people in our region. And in order to get past this pandemic, we need to get to 80% of them having immunity. And so when you do the math, that is a lot of vaccinations, because what we do not want is for all of these people to become immune by getting sick. That is the most unsafe way to achieve herd immunity. And we want to avoid that really at all costs. So if you remember nothing else from my talk, first of all, I want to clarify that for now, the vaccination is voluntary. I have never wanted to make anything mandatory unless there is strong evidence and support for it. That being said, just because it's voluntary doesn't mean it's not important. And as I said, and we'll talk about in a little bit, we need to get to immunity. And the best way to do that is through vaccination. And I think everybody who wants to have a normal, quote, normal life again, we need to embrace immunity and vaccination in one form or another. And so while it is voluntary right now, that does not mean it's something that I consider optional. I think we want to make sure that we get everybody vaccinated as much as we can. When we talk about vaccine hesitancy, a lot of people refer to hesitancy on the part of the people who are to get vaccinated. Those who are hesitant, unsure, for many good reasons, and we'll talk about that. But when I think of vaccine hesitancy, I actually think the bigger problem is hesitancy on the part of the public health and medical community in not being more forceful about recommending this vaccine. And, it's really no surprise, because all of us in science are very used to our, making sure that we're very precise in how we say things. But, that scientific language doesn't translate into commonplace language very easily. What we really need to be saying is that these vaccines work, and they work really, really well. And I think that message has gotten lost in all of the questions about the potential limitations, which frankly, we're now finding are really few and far between. So these vaccines prevent death. They prevent COVID-related death and mortality. These vaccines prevent essentially all COVID-related hospitalizations. When you add that all up in balance, that saves lives. For every day that goes by that we do not vaccinate 100,000 people in this country, we lose 53 more people to COVID. So, every day matters, and we need to be more forceful about this. We accept the flu vaccine in general every year, and it's only 40 to 60% effective, so a fraction of how effective these vaccines are. And so when we put this in the context, this vaccine is a slam dunk good idea, and we just need to do a better job of convincing people that that is true. You cannot get COVID from the vaccine, and we'll talk a little bit about that, but there is no way that the COVID-19 vaccine will give you COVID-19 illness. It's just a fact. And then, as I said earlier, we're already seeing the benefits of this vaccine only 14 weeks into this, with only about 25% of our population having received only one shot and, on their way to getting their second shot. We are already seeing the benefits of this vaccine. So the enemy here is the virus. The enemy here is the pandemic. This is the thing that we're all sick and tired of. And I think there's so much conversation and so much debate and so much discussion happening in the community. But I think we all need to remember who the enemy really is. And it's COVID-19. It's this virus. It's this illness. It's the pandemic. And it's what all of this has done to our mental health, our social connection, our economy, our businesses, our schools, and what have you. We can have very spirited debates about how to manage all of those areas. But I do think we all need to agree that the problem is the pandemic, and we want to do everything we can to get out of the pandemic as safely as we can. I won't go into this slide all that much, other than to say that the way these vaccines work is what they're trying to do is to get the body to recognize these little spikes on the surface of the virus, those little red triangles. The COVID-19 has those red spikes, okay, those little proteins. That's how the body knows that you're being infected with COVID. And the way these vaccines work is by getting your body to develop protection against those little red spikes so that you get over the initial immune reaction, so that if and when you are actually exposed to the real virus, your body doesn't get sick, okay? And this is how vaccines work. And so all of the vaccines that are available are targeting that so-called spike protein, that red protein on the surface of the virus, so that your body can develop the protection it needs in all of the different ways it does that, so that if and when you get exposed to the real deal, you don't get sick. Now, there's a lot of different technologies used in these vaccines, and what I will say is that although the vaccine was developed in really a year, the technology behind all of what went into this vaccine has been in place for decades. So it is a new vaccine, but the technology is not new, okay? And that's something that I think got lost when they called this Operation Warp Speed. It made it sound like it was a rush job. And the reality is, there were parts of it that were accelerated, but the safety parts were not. So 3 reasons to get vaccinated. Number 1, to not get sick, to prevent illness. Number two is to develop immunity in the community. By having immunity in the community, then we don't have transmission from person to person, and that keeps us all safe. And finally, it's to stop the pandemic so that we can put this thing behind us once and for all and start to rebuild our schools and our communities and our businesses. And that's the bottom line. The timeline for this, as I alluded to earlier, has been in place for a very long time. All of the clinical trials, the hundreds of clinical trials that happened across the globe, took place in the context of an existing network of research. So all of these relationships, all of the technologies, all of the ways that we publish and communicate about science, none of that was new. The way these vaccines have been produced is that they actually have been produced before they were approved. So that when they were approved, in anticipation of them being approved, we could hit the ground running. And so that's why you saw, I think it was last week, when Johnson & Johnson was approved, we had vaccine here within 3 days. That vaccine wasn't produced in the 3 days between approval and receipt here in Monroe County. That had already been produced and had been stored in warehouses in anticipation of being approved. If the vaccine is not approved, then it's discarded and it never sees the light of day. But this is the way the manufacturers have figured out how do we get the vaccine into people's arms as quickly as possible. So one thing I think is important to know in full disclosure is that when these vaccines are produced and authorized, there are different forms of authorization. Now, most pharmaceuticals, most drugs, most procedures, most technology in medicine have what's called FDA approval. That process takes a long time, years. When you're in the middle of a public health crisis, we have to make choices, because if we were to wait years to have these vaccines fully approved, we would lose probably another 500,000 citizens in the United States. And that's not a risk that anybody wants to choose. So the path for getting authorization for a vaccine in the middle of a public health crisis is a little more abbreviated, which allows the research to continue while we know that we can deliver the vaccine and get it to people safely. Okay, and so that's where we are right now. So the type of authorization these COVID vaccines have received is called emergency use authorization. Okay, because they are EUA, as it's called, they cannot be mandated by law. Okay, we can only mandate an FDA-approved vaccine, such as we do for the childhood vaccines in schools, for example. So enough research has gone on to ensure that, first of all, that this vaccine is approved and useful to treat a life-threatening disease or condition, which COVID is. That it's reasonable to believe that it's safe. So the short-term side effects, we've given millions of vaccines at this point. The short-term side effects are predictable and manageable. They're not zero, okay? There's always going to be side effects, but we have to weigh that against the side effects of not having a vaccine, which is having more people in nursing homes and older people dying. And so that's where we are with this. Now, it's really important because these vaccines, all vaccines have reactions, okay? That's the goal of a vaccine. We want the vaccine to elicit an immune reaction because that's how we know they work. Okay, those are anticipated. Okay, so part of the body's way of showing that it's reacting appropriately to a vaccine is that you get tired, you get headache, you get muscle pain, you get some joint pains, maybe chills, maybe nausea, sometimes fever, almost always get arm pain. Okay, that's normal, that's good. Now, not everybody's going to have that, but when you have that, honestly, I think that's a really good sign. That's how you know that it's working. If you don't get those things, then you're lucky, but it's still working. Adverse effects, adverse events, or adverse effects are those things that we don't want to see. So sometimes people will have an allergic reaction. It's actually quite rare. Sometimes people will get a blood clot, also very rare. But those are the things we need to manage so that we know how to take care of them if and when they occur down the road. With these two vaccines, almost always the second dose for the 2-dose vaccines is the one that elicits a stronger immune reaction. So people tend to be more tired, more fatigued, have more pain and so forth after that second dose. So I often get asked who should not get the vaccine. And it's actually a very small group of people now. The people who should not get the vaccine, absolutely not get the vaccine, are anybody who is currently sick with COVID-19. So you're currently sick with COVID-19 if you tested positive or had symptom onset within the last 10 days. The reason we don't want those people to get the vaccine is because we don't want them out of the house. They could, in theory, get the vaccine if somebody came to their house and was willing to take the risk, but there really is no reason to take that risk. And we really don't want to introduce somebody who's infected into a vaccination site, because that's the last thing you want to do. Anybody who has gotten convalescent plasma or antibody therapy, so President Trump is an example, he got antibody therapy when he contracted COVID-19. We don't want those people to get the vaccine within 90 days, because the treatment actually prevents the body from developing the immune protection that we want it to develop. So that's a small group of people who've already had the disease, who got a certain treatment. The real only people who shouldn't get it are people who have had a previous severe anaphylactic allergy to one of these ingredients, polyethylene glycol, which is present in some of these vaccines. And most people don't know that that's been their reaction. So if you've ever had an anaphylactic high-level reaction to a vaccine before, those are the people we want to think twice. So in terms of efficacy, and I'll wrap up after this, I think, all of these are effective, okay? They're effective against a placebo, meaning when they were studied, they were compared against a nothing vaccine, a placebo vaccine. None of these vaccines have been or will in the near future be compared against one another in a scientific manner. So, you know, when somebody says which is better, Pfizer or Moderna, there's really no answer to that. We don't have the science to answer that because it wasn't actually studied. But what we can compare is how they compare to placebo, and more importantly, the practical aspects of the vaccine. So all of these are effective. Okay, Johnson & Johnson is also effective. The reason why the efficacy rate was reported lower was because it was studied in December, when there was a higher burden of severe disease, and it was also studied in South Africa, where they have the South African variant, which may not work with the Johnson & Johnson vaccine in South Africa. But we didn't actually see that lower rate in the United States or in South America or Europe, where it was studied. The biggest differences with these vaccines is really the practical aspects. Pfizer, which was the first one, has to be stored at ultra cold temperatures, which a regular freezer isn't even ultra cold. And so that limits its ability to sit on the shelf. Once you open it, you got to use it. It is given in a 2-dose series, one on day 1 and one on day 21. So it's a 3-week interval. Moderna is basically the same thing, except that it does not require ultra cold freezer. So you can use a regular freezer, lasts longer on the shelf, has to be given 4 weeks apart. Johnson & Johnson just came out, and it is a 1-dose vaccine that does not need to be stored in anything but a regular fridge, which means that it's got a much longer shelf life and makes it much more practical. So those practical concerns really are the biggest differences. And so we want to reserve the 1-dose vaccine for, say, homeless individuals in whom finding them a second time might be more difficult. Somebody who's traveling out of state who we may never see again, who we want to get vaccinated. People who are incarcerated. So there are a number of people we want to prioritize for that 1-dose vaccine. But then beyond that, really anybody can take it. And so right now we're in the middle of a situation where we have way more demand than we have vaccine to meet that demand. And so every week, as you'll see today, we just opened up additional eligibility. The previous week's worth of confusion about who can get what and where, a lot of that is going away. So what we are really now focusing on is vaccinating those individuals who are most at risk from having complications from the disease, as well as those who are at greater risk of exposure, which can then threaten their ability to help society function. So that's why we vaccinated healthcare workers first, because if you don't vaccinate the healthcare workers first, then you can't take care of the sick, that sort of thing. So with that, I'm going to pause and hand it back over, and then I'd be happy to take your questions afterwards.
Thank you, Dr. Mendoza. I know, Sam, you're still muted.
Thank you. And Eddie Cruz from the Center for Self-Advocacy is next with his comments.
Yes, hi. My name is Israel Cruz. I'm a peer mentor for the Center for Self-Advocacy and someone who had COVID back in January towards the end. And I would say my biggest concern was not being able to have my direct support staff be able to come in because I contracted the virus. I didn't want to have them get sick also, and having a whole house that was sick too on top of that was not fun at all. So I basically spent 2 weeks without staff. Um, I did just get my first dose of the vaccine on last Sunday. So now I have to go back April 4th for my second dose of the Pfizer vaccine.
How difficult was it for you and your family to get support while you were that you had the COVID-19 vaccine?
Well, I was in contact with my team on a regular basis. My care coordinator would call me every other day just to make sure that everything was okay, make sure that I was able to get everything that I needed. Like I said, it was just very difficult because the fact that my parents were also sick and I didn't have staff to come and help me do my daily things was probably the hardest part, with my parents having to rotate taking care of me. When one got over it, the other one got it. So it was very difficult. But we made it through.
Was it that the staff didn't want to come in, or was that your decision?
It was kind of both because, like I said, I didn't want to spread it even more. And then eventually they did end up having a little bit of symptoms. Like they didn't contract the virus fully, but they did become symptomatic about a week later. So we just wanted to keep that apart.
And from your perspective of being a person with a developmental disability, and Hispanic, how has the community of people with disabilities who are minorities have there been? Do you think there have been difficulties for the minority community dealing with the pandemic?
I think a lot of us have been really doing our research about COVID in general and the vaccine as a whole because we want to keep, as well as everybody does, stay protected as much as we can, and our staff and things like that. So I think it comes up to just everybody doing their research and learning what it's all about.
Thank you, Izzy. Thank you very much.
You're welcome.
Great point. Thank you, Izzy. In terms of giving some of your experience as well as doing the research. Next, as you had mentioned, in terms of the effects of not having staff because of what you went through, Israel, Devin Hedgeman will speak a bit as well as his experience. Oh, you have to unmute, Devin. Devin's with our in the direct support area in field, so he'll speak as soon as he's unmuted there. Okay, we'll give him a few minutes, give him a chance to go ahead and make those changes that are on there. There he goes. There he's unmuted, and as soon as he returns back, welcome, Devin.
Hey, welcome, guys. I work for Empower. I do direct care in Lockport, and I have 8 individuals that I take care of on a daily basis. So that in itself kind of pushed me to get the vaccine. I got it in February. I got my first dose in February, and and I got my second dose in March 10th. We also, all our residents actually got their vaccine as well, their first and second too. I didn't experience any bad symptoms, to be honest. I mean, my arm hurt a little bit for a few days, but I just kind of got it. It was just better safe than sorry. You know what I mean? People are dying from it, and I think people should take it seriously. And it's unfortunate. I feel as though a lot of people aren't getting it because they just go along with what the majority of everyone else is saying. They're not doing their own research, and they're just against it just because their friend, their cousin, their loved one is against it. So they feel as though, oh, I'm not going to get it. Well, I actually did my research just from listening to Dr. Mendoza. I mean, pretty much everything he said is pretty much accurate. Pretty much like all the different reasons why I definitely made sure I got it, And I mean, we're very fortunate to be able to get the vaccine, being the fact that we're first responders, we work in healthcare. Because I mean, there's other people that work in other fields that aren't able to get the vaccine right now. So I definitely took advantage of it, not take it for granted. So we're very happy. I'm very thankful to be able to get the vaccine, being the fact that I work in healthcare.
Evan, was it easy for you to find research materials, as you were just stating, similar to as Dr. Mendoza stated?
Yeah, for sure. I mean, you go on, people are on their phones nowadays, like every second, You go on Google and there's something about COVID, You type something, there's something about COVID. You drive in your car, you listen to your radio station, they're saying something about COVID, So, yeah, it was very easy finding out, the goods, all the good positives about COVID for sure.
Thank you so much. Next, we want to hear from Teresa O'Brien, who will speak with us a bit. Teresa?
Hey, good morning.
Morning.
So as mentioned in the introduction, I have a family member who has a developmental disability, and she resides in a group home. And so my initial information gathering and education about the vaccination was related to my loved one, because I am also her legal guardian, and therefore I provide informed consent for her medical decision making. And so when I was approached on whether I would consent for the vaccine for her, of course, just like any other person or family member, I wanted to make sure that I was making the best decision for her, taking into consideration the discussions that she and I have had about COVID-19 and what she understands about the pandemic and about people getting sick, and also doing some research on the vaccine myself. One of my initial fears, just like I think many people, was that how fast it appeared that the vaccine was coming out. And of course, doing research and doing some education, working through that fear and learning that was not necessarily the case. Again, I tried very hard to get my information from reliable sources like the FDA, CDC. And fortunately, the agency that I work for, which is People Inc., we have been very fortunate in having the agency provide us as employees with information about the vaccine. So it was pretty quickly that I was able to gather all my information and make that decision for my loved one to provide the consent for her to receive the vaccination, which she fortunately has had both doses. also wanted to consider the fact that because she lives in a group home, it put her more at risk in getting COVID. She has a lot of personal health care needs. And so, having that close contact with various staff who are in and out, of the group home, and having her own personal health concerns, getting that vaccine was really important for her. And so, of course, I have a personal stake in wanting to have as many staff who work with her in the group home to get vaccinated, and just, really important to get the word out to everyone that if you're eligible for the vaccine, educate yourself, and hopefully, you'll make the decision to get vaccinated.
Thank you, Teresa. Was it a fine line to kind of walk in terms of that, because of having a loved one, also working in a field with many of your colleagues, but also those that care for your loved one? What would you suggest for folks that sometimes may deal with that same kind of perspective of being a parent to an employee, as well as, working in a field of those that are in this environment and caring for a loved one?
Yeah, so the way that I have personally always dealt with the circumstances that I'm in is I really treat myself as an employee and educate myself and deal with things for myself as an employee. And then I separate myself as much as I possibly can and put my role into a family member of a person who has a developmental disability and resides in a group home. And I try not to cross over lines. I really try to look at each circumstance uniquely. So I try to, prepare myself and work as an employee, and make those decisions as an employee for myself personally, who works in a field, human service field. And then, it's pretty easy for me to transition then to an advocate and a family member of a person with a disability.
Thank you so much, Teresa. We'd also have with us Sarah Taylor that works in the community. So we'd like to hear from you, Sarah, as well.
Well, thank you. Thank you, everyone that went ahead of me. Appreciate the content and the thoughts. I will probably come from a little different perspective. I wear a number of different hats. Eleversity, I provide a number of training in training spaces for providers in corporations around diversity, equity, and inclusion, as well as racial equity. But as far as the content for this setting, I'm also a parent advocate with a child in the behavioral health system, and have become very outspoken lately regarding the criminalization of mental illness, particularly around communities of color. And so when I think about the vaccine and the distrust, I can't help but think about the Tuskegee study around syphilis that we all know historically when we think about vaccines and getting communities of color to come aboard. There is some history. There is some deep-rooted history that distrust is not just there because it's there. It's there for a reason. And unfortunately, over the last year, we have seen heightened levels of disparities among those that are from ethnic groups, among those that are living in poverty. And so we also have seen over and over on TV some things that are not pleasant regarding treatment of Black and brown families, males, our children, our uncles. And so with that, we have experienced in this nation, in this region, in this community, a new level of distrust that has happened for not just one system, for multiple systems. So when we're talking about the vaccine, there's hesitation for a reason. And so while those of us that are on the front lines, those that of us that are in positions to educate, to also that have trusted relationships with many communities, engaging the faith community, engaging neighborhood-based grassroots organizations. Here in Rochester, the Black Physicians Network has done an incredible job partnering with entities to build trust, to have that person that communities trust going in, talking to the families. Like my mother in Pittsburgh is 80 years old. My sister called me today and said, we have to get mommy to take the vaccine. She's saying, no, they're not putting that in me. And so I told her, I'll call her, you know, and as an employee at Eleversity Heritage, I even had my hesitations based on my experience from a flu vaccine. That was my lived experience getting sick. And so it wasn't until I got the second email from our HR that I said, wait a minute, I want to see my elderly mother in about a month. And I also have a little girl that's in residential coming in and out of the house now. And so I need to be an example. And I also need to think about my family. And I can tell you, I made that appointment to get the vaccine, but I also had a lot of hesitation and levels of discomfort based on my own experience, as well as systemic issues that I continue to see across systems. We've done a lot of education in this community, but we also know there are still issues around privilege when we have done tremendous amount of work, and then you have one institution or many institutions show up and have a VIP clinic that puts those with means in front of others with nots. Then the work that we've done in this community is going to take a back seat again when we're talking about equity. So there's a lot of layers when we talk about distrust and systemic issues and barriers for communities of color. And I can tell you, the night before I had the vaccine, I was up all night with all kind of anxiety. Am I going to cancel my appointment? Am I not going to cancel the appointment? Up until I drove there, and I let our leader know, Marisa Geithner, that I was so impressed, because when I went into the building, it was a very inclusive environment, not just with staff, but with the individuals that choose to use our services. So it was very well-oiled machine, organized, but very inclusive. And that spoke volumes for me that there wasn't separation from those that choose to use our services and staff. It was very inclusive. And so it made me feel really good, not just about the agency that I work for, but made it really good of me to get it in a process that was organized and educated. But it took a long time for me to get there. You know, my daughter-in-law is a pharmacist also, and very involved with Black female pharmacists. And I even had to call her and a number of physicians that I know to ask questions, because as much information that I do have, I still had my hesitations. And so now I'm going out there educating and respecting. We also have to recognize that there's cultural differences in beliefs of individuals for a number of reasons. I have close colleagues that are from the Native American and indigenous populations that may, for whatever reasons, not want the vaccine. And we have to respect that. We can educate and we can inform, but we also have to respect where people are and families are and individuals are with their choices that they do have. As Dr. Mendoza mentioned, yes, we want people to get the vaccine, but we also have to respect choices for whatever reason that choice may be.
Well said, Sarah, and a powerful statement in terms of saying being informed and making informed choices, but also passing on that information. I think all of our panelists that we have here have made stress that there were other underlying concerns, either loved ones, hesitations culturally or historically, as well as just those that have not had the access to gain that type of information. Sarah, how would you say it was to uh, be able to share that as well as learn in the same process that information that you received?
Absolutely. You have to share it. And we know when we're talking about access, as you mentioned, the digital divide is real. Those of us that don't have employers setting up appointments, if I had to tell my elderly grandmother or someone with a cognitive or learning disability to get on and navigate those websites, if I had to navigate the website, I probably wouldn't have done it. So again, recognizing there are barriers and we have to do everything possible, like the advocates that are going door to door in some of the urban communities, educating them and sending out people, trusted advocates in the community, going door to door, helping them, taking laptops, access appointments. We have to get creative, and we talk about person-centered all the time, but we really got to step up and not be afraid to go in communities, in our marginalized communities, and speak to family, but speak to them in terms that they understand. As Dr. Mendoza's others said, some of the language, even myself, as a social worker and a former administrator, you got to talk to me in plain language. You have to really meet people where they are, and understanding that there's different stages of readiness in willingness at this point, but to educate and inform, but in a way that is understandable in the language and communicating in a way that is understood.
Thank you. Let's
Sarah,
go
can I
a little
ask
bit
you?
deeper. Sam, go ahead.
I want to ask Sarah a question. I was wondering, do you see where the information is getting out to people with intellectual and mental health disabilities? And if so, who is giving them the information?
You know, I think there's some different advocacy groups doing the best they can to, whether it's seniors. I've seen, and again, I'm physically in Monroe County, so I could speak for what I see that's going on here. I think there's been a great job getting out to seniors. I can't say outside of those that are receiving services from particular program, I can't say that I've seen a real aggressive grassroots advocacy to go into neighborhoods and communities to reach those with developmental and intellectual disabilities that may not be connected to services. I think agencies have done a great job for those that are connected with them. But how many thousands of people are not connected with services, or based on the pandemic and shift in services that may have fallen off of rosters and that may not be connected or deemed not engaged or compliant, when really right now there's a heightened level of distrust. So to answer your question, Sam, I think we can do a better job, particularly at reaching those that may not be connected or really have that level of communication. We have to continue to advocate for those that may not have a voice or an advocate in their corner.
Thank you, Sarah. Does anybody have anything else to say on that topic? We already know there's barriers out there, but for people in the community, um, speaking about people with developmental disabilities, people with mental health disabilities, personal care staff, are there barriers for the people that work with people with disabilities, and how are they getting through those barriers? Izzy, do you want to say something on that topic? Or?
I mean, I would just say for me, I think the work based on getting people information, I think the work that we're doing with our groups and getting as many people information about the vaccine in general. I know if it wasn't for my care coordinator, I probably wouldn't be as informed as I am about all the things that come with getting vaccinated and making sure that your staff is okay to come and work for you and things like that.
Thank you, Izzy. Thank you very much. Dr. Mendoza, I know that we covered this a little bit, but we know there is hesitancy to take the vaccine. And if somebody already had COVID, should they take the vaccine and how long should they wait? Just to reiterate what you said in your comments earlier.
So somebody who has COVID through natural infection, so they catch it from somebody else and they may or may not become sick. We believe that they have immunity from COVID for about 90 days. What we don't know is how good that immunity is. So we think that people who were very sick and had a lot of symptoms are more likely to be more protected, but we don't actually know all of that because that's not something that we've been able to study. So what we're advising is that anybody who's had COVID, they can get the vaccine as soon as they are symptom-free from their initial infection. Once they've been cleared from isolation, once they're no longer contagious to other people, they can move about the county as they normally would, and it would be perfectly safe for them to get the vaccine. Earlier, when the vaccine supply was really, really reduced, we were telling those individuals, it's okay to wait because we want doctors and nurses to get their shot because those who've already had the illness were probably already protected. But we're now getting into the phase of the vaccination program where supply is opening up, and I don't think we're going to need to be doing this kind of balancing act for very much longer. I anticipate in the next 2 weeks, essentially everybody will be eligible for the vaccine. So we're not going to be doing this, who's eligible, who's not eligible thing for very much longer.
Thank you very much.
I'm going to pose to Devin and with Teresa just a little bit because there's been a lot of conspiracy types of theories of things that have gone out in terms of how the vaccine came out so fast, what it was make up. I think Dr. Mendoza, you had made mention about how it uses a genetic type of coding of what it is. And have some of you heard in terms of some of the things that it talks about how it affects genetic makeups to people of different cultures, or that there might be microchips, or that it could cause Bell's palsy, and then the unknown, as well as for the women's ability to have children when they're pregnant. So I'll open that up for the three of you in that area. And then my one question I did note down, I know Dr. Mendoza, you had mentioned something about anaphylactic, a bit of a deeper explanation if we get a chance with that for my own edification. Teresa, Devin, how would you like to comment?
So I have heard some of those theories that you mentioned, Brad. Being on Facebook, having friends, through Facebook, you see different postings. I've had some close friends and family members post what they feel are factual, sources and information. But when you dig a little bit deeper, you could tell that the information isn't necessarily what I would consider a reliable source. So again, my own personal crusade, to get as many people educated and vaccinated, just reaching out to people who are my own personal friends, and just, asking them to do a little bit more research and going to reliable sources, again, like the CDC, like the FDA sources, and doing more research. Sometimes it's difficult to talk people out of, their beliefs in certain topics. But the more information you could provide to them about some reliable sources that are out there, I think the better. But there are going to be, people that for one reason or another choose, not to do that. But again, just knowing where you're getting your information from is important.
Devin, any additional comment to that? I know you're muted there again.
Did you say me, Sarah? I'm sorry.
Oh, I was getting Devin, and I come around to you, Sarah, as well. We're gonna get ready as Devin makes his comment. We'll then, with a few minutes, we have about 6 minutes. I want to make sure everybody gets a chance to make a last statement. Go ahead, Devin.
Yeah, I definitely agree a whole lot what Teresa was saying. There's definitely going to be that false information out there, and I did hear about that as well. But you do just have to rely on reliable sources. You can't just, just believe everything that you hear, So that's what I did. I even have a few friends that I went to high school with that are actually physicians and stuff as well. And I didn't mention that at first, but I just remember that. So I had a lot of good, positive people in my corner that kind of steered me into the right direction, along with, doing my own research myself. And that's how I just made my informed decision, So I feel really good about it.
Thank you. And just to come back with you, Dr. Mendoza, and then we'll go into final comments from all of our panel today.
So the anaphylactic reaction is a severe allergy to anything. It could be a medicine, could be a vaccine, could be anything. That typically ends you up in a hospital. So you have difficulty breathing, your throat tightens up, very severe. So that's thankfully very rare. But that's a medical emergency that you can see with any vaccine. So I'll just start by, first of all, thanking you all for inviting me here today. I've learned a lot from you, hearing your perspectives, hearing your thoughts. Obviously, we're very involved in trying to get the vaccine out to the community, and I think to the extent that I can learn more about all of the different stakeholders in our community, that will help strengthen our ability to get this vaccine out there. As we look ahead to the coming weeks and months, we all know that our approach will have to change, because the early months, it was frankly not hard to get people to come in because there was a whole lot of demand. It's like people who want the new iPhone on the day it comes out. You pretty much don't have to do anything and they'll show up. But we're not there anymore. With this vaccine, now we have more and more and more obligation to educate, to listen, to earn trust. And to that, I will say, first of all, Facebook is awful for information. It is not a reliable source in general. If it refers you to an article, look at the article, but do not trust comments. They are a pandemic in and of itself of misinformation. When you stop and wonder whether you want to get the vaccine, I guess all I would say is we've entrusted the entire healthcare community to get this vaccine first. And we've all gotten it because we all believe in it. We wouldn't, if for those who think that we're trying to, enact some conspiracy theory and implant microchips and other things into people's heads, why would we start with doctors? Okay, that makes really it just doesn't work when you think in terms of those theories. These theories, like I said, are an infectious pandemic in themselves. So, with any pandemic, we have to fight against this misinformation. But our livelihood depends on everybody's ability to get accurate information. And we will not see a normal light of day until we put this misinformation in its rightful place.
Thank you. Israel, final comment?
Yeah, I just want to thank everybody for having me today. I love doing stuff like this. Brad, as you know, we've done a lot of work in the past.
Sure.
And everybody needs to do their research on everything that's going on right now. Misinformation is huge. So before you go out and try to listen to other people, make sure you understand what you're getting into first. And yeah, thank you guys.
Sarah, final comments?
Thank you. I just think we have to meet people where they are and to understand our current environment, that there is a heightened level of distrust, that disparities are real, that systemic racism is real, and that we have to begin to go to our communities, particularly marginalized communities, and educate them in terminology and in manners that foster trust and that choice. And that we are educating them the best way possible with trusted members of the community.
Thank you. Teresa, final comment.
Yeah, just, again, I've made the personal decision to get vaccinated. I believe that, vaccinations are part of your preventative health care. But again, it's a personal decision. And the best thing that you can do is talk to your healthcare provider, get information from reliable sources, and educate yourself on whether or not that is something that you would like to do. But personally, and advocating for, again, my family member who's in a group home, it was the best decision for us to prevent her from getting COVID, and obviously my personal decision to prevent any further issues with COVID. So, just get your information from your healthcare provider and a reliable source, and hopefully you'll make the decision to get vaccinated.
And Devin, final comment.
It's been a pleasure speaking with all of you and having you all today. And yeah, I just think, it all comes down to just let's get back to normal already. You know what I mean? I mean, man, this has been like just about, a year right now? I want to get things back to normal. I also want to be safe. I don't want to be in a hospital. I want to have gatherings again eventually, and do all the normal things I used to be able to do. And so, like I said, it's just a privilege to work in the fields where I was able to get the vaccine, where the information was there. And I would really just strongly encourage people to just look into it if they haven't looked into it, and make a good informed decision.
Thank you so much, Devin, all of our panelists joining us today. Sam, I turn things over to you to close us out.
Well, I want to thank you, everybody, for attending. And I think we really provided some good information for direct support professionals and people with disabilities. And I really am encouraged that the information that you've shared will be very helpful to a lot of people. Again, thank you very much for everybody. Dr. Mendoza, Izzy, Sarah, Teresa, Devin, Brad, thank you very much. And everybody have a nice day.
It's been a pleasure working with everyone, being on this esteemed panel of experts and experiences. Please remember that Person-Centered Services is also going to be providing some content soon geared towards people with intellectual and developmental disabilities and families. This has been a DAWNY event, the Developmental Disability Alliance of Western New York. Please, if you'd like more information and to see this event, it will be on the DAWNY website, DDAWNY.org, to learn more. And we hope this will not be the end of our discussions, but as Devin said, the beginning of us moving into our newest normal. Thank you again, everyone, for joining us. Please have a spectacular day and continue to spread awareness and help others to learn more so that they can make those informed decisions. It's great working with you again, Sam.
Thank you.
Have a wonderful day.
You too.
Thank you all.